We provide a service for adults suffering with mental health diagnoses, and the aim of our service really is to promote independence. In January 2015 we redesigned the service, and I think we had a very much of a patient focus rather than a person focused. When we discharged people from a 24-hour hospital setting where they'd been for roughly a few years, they were going straight into the community with very little support. We came up with the idea to close 2 of those units, which was reducing the beds by 15, so which is quite a big step almost to take beds out of the system. But we supported that with setting up a new recovery centre, and that was done in partnership with the third sector. And I think on the national picture it's really important for us to be starting to think about partnerships, how we work with organisations more locally and the pathways we create for service users. And I think those organisations just challenge our practice and help us think differently, help us think about how we get people out into the community, because ultimately we don't want people in hospital. One of the most important things we've implemented here is a cultural shift, and that is that cultural shift from being very inpatient, patient focused to an outward looking service that's about the person. And the impact of that cultural shift is massive. I think the service user experience is better. They're reporting and telling us that they feel more supported, they feel more confident, that they're able to access things in the community. Having a team that can support that and be around for people when they really need it, which is that transition from hospital back into the community, has been a huge success.